In previous class, we discussed about hepatobiliary radiology and pathology. Okay. Today we will discuss about pancreatic pathology and radiology. So, what are the important scan, radiological scan to be advised? Okay. Today we will discuss if any disease occurs in pancreas. So, what are the diseases and what are the scans to be advised to the patient? Basically, pancreas, we all know that. Okay. Pancreas are glands, both works as endocrine and exocrine. Means for it is utilized as hormones and for digestion, both digestion. Okay. So pancreas has two functions. One is for digestion and another one is for hormones. Mostly the important hormone the pancreas is secreting, that is nothing but insulin. Okay, insulin. And for digestion, it is sending the digestive enzymes, pancreatic enzymes, amylase, lipase, to digest the fat substance. Okay. So basically, what the diseases occur. So mostly, whoever take alcohol, okay, alcohol consumption, excess amount of alcohol consumption, okay, they have damage of pancreas. Okay. So let's see the images of pancreas. So basically, next thing you have to remember about pancreas that if any pain in abdomen, abdominal pain, abdominal problem, the first investigation of choice is that is USG abdomen. USG abdomen. After that, any problem occurs. So after doing ultrasound, the patient have vomiting sensation. Vomiting is related to uh, abdomen. Abdominal pain is related to abdomen. Loose stools are related to abdomen. Any gastrointestinal tract. Okay, not abdomen means gastrointestinal tract. So these all symptoms are related to gastrointestinal tract. So what you have to do? First, advise ultrasonography. So this is the first investigation of choice. If the patient have any problem in the GIT. So what are the organs comes under GIT? Yesterday I told. First is esophagus. Second is stomach. Third is small intestine. Fourth is large intestine. Okay, these are the first four organs. Next, two organs, liver and gallbladder. Next two organs, last two organs, pancreas and spleen. Okay, so any problem occurs in the abdomen, abdominal symptoms, so you have to go ultrasonography. So this is the stamp. Okay, you have to remember. If after doing ultrasonography, the patient had any problems in the pancreas, okay, pancreas. So what the actual problem in the pancreas you have to understand. Then the investigation of choice for parenchyma of pancreas means the study of cells within the pancreas. So you need to take CECT. The Please note down that investigation of choice. This is the first investigation of choice. This is investigation of choice for pancreatic cells. What is CECT abdomen? CECT abdomen. Okay, CECT abdomen means you have to give contrast, IV contrast. Next, we know that the pancreas has ducts. Okay, Messina ducts, everything, most ducts are there. So which are coming under small intestine. Okay, so if you want to study the ducts of pancreas, how the hormones are going, how the digestive enzymes are going, so you need to take the important scan, that is MRCP. So this is the investigation of choice for ducts. Okay, MRCP. And the golden standard means exact problem you want to know, then the ERCP. MRCP is the term, full form is magnetic resonance. MR means magnetic resonance. CP means cholangio pancreatography. Cholangio pancreatography. Cholangio to see the pancreas. Cholangio pancreatography. Okay, this is the investigation of choice. If you want to take the golden standard, what is the golden standard for pancreas? That is ERCP. ERCP means endoscopic. Endoscopic. Endoscopic retrograde. Okay. Retrograde cholangiopancreatography. Cholangiopancreatography. So these are the this is the golden standard. This is the investigation of choice, MRCP. And this is the first investigation, ultrasonography. This is how we have to advise the patient. So first you have to go through ultrasonography. So any problems you saw in the pancreas. So if in the pancreas, go through CECT. If it is duct, okay, you can advise MRC, but it is very costly. Okay, gastroenterologist will do the hepatomegalist, or whoever the specialist in GIT, he will do the scan. Okay, so let's come to the pathological part. We discussed here important things. First, common diseases occurs in the pancreas, that is acute pancreatitis. Okay, first acute pancreatitis. What is acute means suddenly. Pancreatitis means inflammation of pancreatic cells. Okay, cells of pancreas are getting inflamed. Why this happen? Here, the reason are given due to the stones, 40% due to the stones. Okay, 35% due to the ethanol, means drinking alcohol. So 82% are related to other things. Next, idiopathic. Idiopathic means unknown. Unknown reasons are also there. Okay. And another one is thromboglobulin. It is the important thing. That is, it is also a, so it is important. That is, if it increases, also the acute pancreatitis occurs. So how you can diagnose this? You have abdominal pain. If you check the blood value, if the blood, if you check serum lipase, means the pancreatic juice, it will more than 3. CT scan, after doing CT scan, CECT abdomen will get positivity. Okay. So these are the acute pancreatitis. So what is the investigation of choice here? CECT abdomen, and initially we'll go to the ultrasonography. In ultrasonography, the size of the pancreas are more than 24 centimeters. Okay, this is the important thing. Acute pancreatitis. Next, we have chronic pancreatitis. This is the second most common disease or pathology of pancreas. Okay, the patient have long standing abdominal pain. This is the symptoms. First symptom is the patient have long standing pain. So what you have to do, you can do ultrasonography. Then if it is ducts problem, then MRCP, or if at a cell problem, CECT abdomen, you have to advise. So what you will get: fibrosis, calcification, any stone, atrophy, means shrinking of pancreatic cells. Okay. So what will happen? The production of insulin will reduce. So cannot absorb the digest the food. Abdominal pain after eating increases. Okay. Weight loss, everything will be seen. So vomiting sensation. So these are the things you can notice during chronic pancreatitis. So what you have to do? You have to do go with the for diagnosis purpose, CCT abdomen is best choice. Okay. Next, investigate next problem the mostly occurs, that is two problems are there, most common problems. That is autoimmune pancreatitis. So there is our body cells only damaging the pancreas. So that is called AIP, autoimmune pancreatitis. So this is the normal pancreas. You can see the autoimmune pancreatitis in this own body system is damaging. Okay. So this is the condition. What will happen? You can see pancreatitis, inflammation, and all the features are same as chronic pancreatitis. So this is the third thing you have to remember. Next, the common disease which seen in most of the cases in the pancreas, that is carcinoma of pancreas. It is the tumor, okay, tumors, cancer in the pancreas. Okay. And the most common cancer area is head. This area, because of because of uh, digestive enzymes, due to the digestive enzymes. So investigation of choice is CCT abdomen. You can see that this is the tumors. Okay, these are the problematic areas we have. Okay, so this is about pancreatic radiology. So we discussed about diseases and important investigation of choice. Okay, so we completed whole abdomen. Okay, in that esophageal pathology radiology came, stomach pathology radiology came, small intestine pathology radiology came, large intestine pathology radiology came. Next, liver, gallbladder, pancreas. Spleen also had some important things, one or two cases. So tomorrow we'll discuss about spleen also. Okay, but here most important organs we discussed in GIT. So after spleen we have we'll go to go through the another system. Which system we will discuss after the gastrointestinal tract? Next we have genitourinary system and genitourinary system. Okay, we'll discuss tomorrow. Okay, any doubts? Kindly ask.